How safe is the AstraZeneca vaccine? Is the debate over blood clots now finally over? And how will the warnings of the vaccine shortage affect you? I'm ITV News presenter Lucrezia Millerini, and with me for this edition of Coronavirus What You Need to Know is our science editor, Tom Clark. He's here to answer those key questions and more. Hello, Tom. You joined me after a really big announcement on the Oxford AstraZeneca vaccine from the European Medicines Agency. Now, this after the leading nations in the EU, France, Germany and Spain, all halted the vaccine amid concerns over clots. The EU regulator said it agrees with the UK regulator. There is no evidence that it caused blood clots. So how did the EMA come to that specific verdict?
Yeah, I mean, it's been a really challenging one, this, for the EU mostly, because obviously the UK has decided, despite this evidence being discussed in Europe and also some evidence in our own data, to continue with our rollout. The EU countries chose to suspend theirs, and the regulator were left with this difficult position of having to then very rapidly crunch the numbers, assess the evidence so that EU countries can get their programmes back on track. Because I just calculated today, 14,000 people have died of COVID across the EU in the week since the first EU country suspended it. Now, obviously, they haven't died because they didn't receive the vaccine, but it gives you an illustration of the burden that they've got. And by suspending a programme like that, it's really, really significant. It's going to have an impact. So what they've had to do is sift through all these different reports from different parts of the EU of blood clots in various people who've had the vaccine and try and establish, are those blood clots caused by the vaccine itself, or are they blood clots that would have happened anyway? Because these are the sorts of things that happen all the time. And when you start giving a vaccine out to millions and millions of people, you start to see very rare, events that would happen just naturally anyway come up in that data. And teasing out that signal as to whether it's caused by the vaccine is really hard. So I think the overwhelming conclusion they come to is because the events are happening in vaccinated people at rates that are much lower than you'd expect naturally anyway, they're also happening in all different types of vaccines. So it's happening with the Pfizer vaccine and the AstraZeneca vaccine and the Moderna vaccine. It's happening at a rate lower than you expect to see normally. They've been quite confident in concluding this is not linked to vaccination. Therefore, the risk, the benefits of the vaccine far outweigh any risk they've managed to detect so far. So it really should continue being used.
That conclusion, the benefits outweigh the risks, sure is there, but they are still investigating, aren't they, this rare blood clotting syndrome. Just tell us about this and how concerned should we be about this?
I mean, that is the really interesting thing. And in fact, the reason that Norway and Germany suspended use of the vaccine was because not of general blood clots. When I say general blood clots, these are the ones that typically, you've heard of deep vein thrombosis, a blood clot in your leg that then makes its way up and gets stuck in the lungs and causes something called pulmonary embolism. That was the original safety concern. That they've ruled out. But they have found from these cases in Germany and Norway, very, very, very few cases, we're talking 13 across the whole of the EU, that is linked to a blood clot in the brain. It's got a very complicated long name. I'm going to try and remember it for you now. It's called CSVT, which stands for cerebral sinus venous thrombolism. So I got it wrong.
Oh,
and you
nice.
So it's cerebral sinus venous thrombosis. It's a blood clot in the big vein that runs down the middle of your head. It's very, very rare, and but they've seen an increase in numbers of that in people vaccinated with the AstraZeneca vaccine, just 13 cases out of more than 5 million people vaccinated. Because it's so rare, they couldn't ignore that signal, okay? So they are still slightly concerned about this event. And we've seen 5 cases of it in the UK out of 11 million people vaccinated. Why should we sort of not be so worried about that? Well, one of the things they're very keen to reassure us is COVID itself is one of the leading causes of blood clots that we know of. And they're not 100% certain that people are having this very rare brain clot event because have they either been infected with COVID and not known it, or are they currently infected with COVID when they get the vaccine? It's very hard to tease that signal out. So they're currently digging into the individual case histories of these patients to try and find out more. So it might take a little bit longer to try and establish that link. But the reason they've gone ahead and said, look, it's safe, the benefits outweigh the risks, is because even if this was linked to the vaccine, it's happening at such low rates, it's perfectly tolerable given the risk of getting COVID and then dying from it. To give an example of what those risks are, based on the UK data, your chance, assuming this was a risk linked to the vaccine, your chance of this blood clot in the brain happening is about 1 in 2 million, okay? Your chance of getting struck by lightning is about 1 in 500,000. So you're 4 times more likely to get struck by lightning than to have this blood clot as a result of the vaccine, assuming it's even linked to the vaccine, okay? So it's a very, very rare event. What they are recommending in Europe, though, is because there is this slightly suspicious signal, they're going to put it on the warning label of the vaccine and say, look, this may be a side effect if you are young, because it can be happening in younger people, and you have a splitting headache, which is the key symptom, and a really, not a mild headache, a really severe, debilitating headache, you might want to call your doctor and find out more. But it's happening at such low rates, we wouldn't know about it anyway.
I mean, at the moment, even if there were to be some kind of causal link, it would still be rarer than getting struck by lightning. That's
pretty much the long and short of it. The leading cause of this blood clot on the brain normally is actually the contraceptive pill. The contraceptive pill has always come with a slight increased risk of causing blood clots, and it's something that a doctor would explain to any woman when they come to get a prescription of it. It increases a woman's chance of having a blood clot in the brain like this by about 8 times, a significant increase in risk. But the chance of this happening is so low in the first place, we've never even heard of it. Have you ever heard of that particular blood clot risk to the brain because of the pill? No, we haven't, because it's barely noticeable. It is there, it does happen. You speak to specialists who say it's there, but it's one of those risks that we accept given the benefits of the medicine that we're choosing to have. And what doctors are really keen to point out today is we need to think about this in those terms when we go and get a COVID vaccine. Your chance, my chance, I'm 47 years old. My chance of dying from COVID if I get infected is about 1 in 500, okay? My chance of getting this blood clot from the vaccine, even if it is linked to the vaccine, is about 1 in 2 million. So I know which odds I'm going to go for in that particular situation.
For sure. Boris Johnson today reiterated, after hearing what the EMA announced as well, that, the benefits of the vaccine far outweigh the risks. We talked a little bit about this. It's not even approved risk at all, but there was something they're looking into. What are the actual risks that we know do exist, and how significant are they?
From the data that's out there, and it is growing all the time, and remember, we are vaccinating so many people now. We're up to 27 million, I think it is now, in the UK vaccines we've given, more than 11 million of the AstraZeneca vaccine. We know that it can cause really painful arms. It can cause very severe flu-like symptoms. I've spoken to friends of mine who've literally been wiped out in bed for a day, feeling really quite ill after the vaccine. But they're short-lived. They are not life-threatening. And that really is about the long and short of it. What they've been looking for in this data is dangerous side effects, things that actually give you a lifetime risk, and they are not there. And if you weigh that up against the serious risks of COVID, hospital, whatever, not forgetting also the risks of long COVID and some of the chronic issues even young people are facing, having been infected with COVID. That is the argument they're using to say, look at the risks of the vaccine, look at the risks of COVID. The maths just stacks up very much in favour of getting the vaccine.
I'm involved in a bit of a Twitter debate right at the moment, well, not right at the moment because we're doing this, but about the fact that if you are healthy, there's no point having the vaccine and putting yourself at risk. How do we respond to that view?
That's a really interesting question. There's kind of a cardinal rule in medicine. You don't give someone a treatment for something unless there's a clear benefit to them. Because any medical treatment, anything, carries some kind of risk. As we know with COVID, your risk of dying from COVID if you're under 30 is really very, very small indeed. So is there a question about, if I'm young, should I take the COVID vaccine? Given I'm not, I'm probably not going to die from it. I think that's missing 2 really important points. We know that COVID can cause long-term health problems with some people, and some of those people are quite young, and some of those problems are only beginning really to emerge in how severe and how long-lasting they might be. So that's for one, the risk of long COVID. Secondly, we know that there's a large percentage of vulnerable people, elderly people or vulnerable people, who are unable to get the vaccine. Maybe as much as 10 or 20% are unable to get the vaccine. So You, by getting the vaccine yourself, even though it might not be giving a benefit directly to you because your risk of dying is quite low and you, for some reason, aren't worried about the risk of long COVID, you are also, though, helping to protect many people in society. That's a kind of public health message. Obviously, it won't get through to everybody, but add those two things together, I think there's still a really strong argument that anyone who's offered the vaccine who's over 18, which is what it's currently recommended for, should go and get it. And we accept that already in society. We vaccinate kids as young as 5 against flu to protect older people against flu, because we know that vaccine is safe, and it's just the same for this one.
Okay, let's slightly change direction here, because we've heard a lot of this week, haven't we? The government facing scrutiny over the vaccine supply after the NHS warned of a reduction in England in April, and this has caused a lot of concern, especially with the rollout of the vaccine for the under 50s, the 40-year-olds, that bracket.
That's right. I mean, I was just getting really excited, okay, because I'm 47. Actually, I'm 48 tomorrow. It's my birthday tomorrow. I'm 48 tomorrow. I saw that announcement that we were going to get last week. There was an announcement we're going to get more vaccine doses, a doubling of vaccine doses. And I thought, oh, brilliant. I'm in. I'm really close to getting my vaccine. Probably I'll be getting it by the end of March, maybe early April. Mm. And then a week later, a letter gets published saying, actually, there's going to be a shortfall of supply. We're not going to offer any new appointments for first doses throughout the month of April. So I can really feel for a lot of people out there who got their hopes up thinking, all right, I'm next, and now probably going to have to wait till the beginning of May before a new vaccine appointment. So it is a significant worry and concern.
This is specifically Oxford AstraZeneca.
The shortage that we're going to see through April is because a delivery of AstraZeneca vaccine from India, which is a total 10 million doses. We've only received half of that. They also have to batch test a lot more. However, they're going to share out both Pfizer and AstraZeneca doses evenly over that period. Because remember, there's a lot of people waiting for their second dose of the Pfizer vaccine. There'll also be people waiting for a second dose of the AstraZeneca vaccine. One of the reasons they cancelled appointments in April, it's not because we haven't got enough vaccine to go around everyone. It's they've got to prioritise those second doses because they're committed to giving them within 12 weeks. So what they reluctantly had to do is pause the rollout of new vaccinations.
But finally, Tom, this hold up that we're hearing about now that you've just explained as well, but is the government likely now to still reach its targets with the vaccine rollout?
The government's on track to meet that initial target of vaccinating the most vulnerable by the end of April. So that's all sort of taken care of. Yet there is a question though. They've also said they're going to do the whole adult population of the UK by the end of July. You would think, looking at that number, maybe that's in doubt. They're sounding though quite confident they're going to do it. And I think there's two reasons why. One, the AstraZeneca supply issue is a temporary one. They anticipate that will sort of correct itself. We've got no foreseeable problems with the Pfizer vaccine coming into the country. But the other thing, and this is the ace up their sleeve in a way, we've also got really good orders in for some very effective vaccines that haven't yet had approval. So there's the Janssen vaccine, which is a single dose vaccine. We've got millions of doses of that. We've got a vaccine called Novavax by an American company that's just had some really good clinical trial results. Both of those are expecting approval from the regulator in April. So we could have a real flush of new vaccines coming into the system in late spring. So I think, and I forget to mention, we've also ordered 20 million doses of a vaccine from a company called Moderna, which is already approved. They've just been quite slow in coming. So I think if you factor in all those kind of supply chains and pipelines working their way in late spring, early summer, I think probably by the time that deadline's approaching, we'll have more vaccine than we know what to do with. So I imagine it will ramp up quite quickly. So I think the government is quietly confident they're going to hit that target. Obviously, right now, they can't count vaccines that they haven't approved yet, but they do know it's a good chance that they're going to come. And I think even with the supplies they've got and the orders they got in with Pfizer and AstraZeneca, they could probably just about do it anyway.
Well, that's good news. Is Moderna, is that the Dolly Parton one?
You got me there, Lucrezia. Love the Queen of Country, though I do. I am not sure whether she had it or not. I'm taking your word for it. Yeah, I think it could be.
I think she donated $1 million towards it. I think she did.
She did. I'm getting a thumbs up from David. Yeah, that's the
Dolly Parton one.
That's the Dolly Parton vaccine. Like all those COVID vaccines, they seem to be effective and really good safety signals. And there's nothing really you can do to determine which one's better or not.
I'll have anything going, Tom.
Me too.
Listen, Tom, thank you so much for taking the time on a really, really busy day.
No problem.
And happy birthday as well. Happy birthday.
Thanks very much.
Thanks to everyone else for listening. You can dive into our back catalogue of podcasts to find out more about the vaccines. And if you're among those worried about returning to crowded trains and supermarkets after lockdown ends, then we'll soon bring you an episode with ways to cope with your anxiety. Until then, bye for now.